Hey, so hello, Fallon, Dr. Fallon. Thank you for coming.
Of course. Thanks for having me.
Yes. Okay, so I'm going to start with a couple of questions about you. What is your name and what is your job title?
So my name is Dr. Fallon Long, and I am a family chiropractor here in Tulsa, Oklahoma. And I have an emphasis on pediatrics and pregnancy care.
Okay. And what is the organization that you work for?
I work for Lumos Chiropractic.
And is it your business or do you work for somebody?
I am the owner and sole practitioner here at the office.
Okay, great. Can you explain to me a little bit how you came into being a chiropractor? I mean, I know you have to go to school and things like that, but what made you decide that you wanted to be a chiropractor, and how did that look?
So when I was growing up, I always knew I wanted to be in healthcare. From the time I was a little kid, I'd be like, I want to be a vet, I'm going to be a doctor, those sorts of things. And I graduated from high school and went into college and had a pre-med track, full plans on going to medical school, becoming an MD. And the more I shadowed doctors in those clinical settings, the more I realized it wasn't for me and that I really didn't enjoy it. It was kind of depressing. And I thought long and hard about why that was the case. It just kind of boiled down to, I felt like the doctors that I was shadowing, they were having this just revolving door of patients showing up who were sick, providing them a medication, and then those patients never really got better. It was just like this constant cycle of more meds, more sickness. And I was like, I wanted to get into this to help people. So how do we help break this cycle, or at least help people gear towards more of a actual health and wellness or mindset? As I was having that thought, I got injured and decided to go to a chiropractor for the first time. And it helped with my low back pain tremendously, but then I realized that it helped with my mental health as well. And I've struggled with anxiety and depression since I was about 16 years old. And I noticed that my anxiety and depression seemed like they were getting better. And I was like, whoa, what is going on here? And my chiropractor explained to me about all the neurological pathways and how that could be playing a role and how it's really common for people to have that as a side effect of chiropractic. And I knew that I had to do this. I was like, okay, I hate this med school track. I think I want to do this. And I immediately applied for chiropractic school. And then I ended up having bad experiences with my doctors when it came to my reproductive health. And so I wanted to be able to provide the tools for people who are having issues similar to me. And so that's kind of how I got into helping women's health, getting into pregnancy. And then when you help a lot of pregnant people, you end up helping a lot of kids because those kids come out eventually.
They do. I know.
Yeah, so long answer, but that's kind of how I ended up here.
Okay. So this is a great segue into children. Do you have any children?
I don't have any kids. I am a proud auntie and godmom. Turtle mom. I have a pet turtle that I've had since I was 3. I've just always had a passion for children and being around them, and I just love them.
So you don't have any children of your own, but you have tons of children that you care for, obviously. You are in a relationship. I hear that you just bought a house, so that's
yes,
great.
ma'am. We're very excited about that.
And do you have any hobbies outside of chiropractic care?
Yes.
Your job.
I love baking and cooking, so you can almost always find me in my kitchen, which is my favorite place in our new house. Also very much into being outdoors and going hiking and things, so we love to go to Turkey Mountain and going on walks. It's a little difficult to get into some of my other hobbies right now because of COVID, but I'm also an avid bowler. I have
Really?
I've bowled in leagues off and on since I was 15.
Man, I'm so bad at bowling. I like to pretend the more points that you have, that's how it works, right? The more points that you have, like you're winning? Isn't it the less
Uh-huh.
points that you have, you're winning in bowling?
No, bowling, more points good.
Oh, well then the other way around, because I need one of the bumper things.
You're like, the lower the numbers, the better, because then I win.
Yeah.
Well, I'll
So
have to
anyways,
keep bowling sometime, and I'll give you some tips.
yeah, once we don't have to like wear masks into the
Yeah, exactly.
okay, so with your um, boo and your hobbies and, you know, just living a life. So for me, I reached a point where I just had to set a very strict boundary, and it was easy for me because as soon as I picked my son up from school, it was his time, right? So like it took me a couple years to do that, but it just for my sanity, the boundary was really important, because if I didn't, then I'd find myself on the phone or answering emails or whatever late into the night and really just like neglecting my child. And so
Mm-hmm.
I really set that boundary of like after 5:30, it's his time, you know, and he might be doing his own thing, but I'm definitely not working. So
Mm-hmm.
it was hard for me to do, even with another responsibility. How is kind of like the boundary of taking time off and self-care and things like that for you? How does that look?
So that's something that's really important to me. And I started practicing here in Tulsa in 2016. And so that was really when I got the ball rolling with being very, very busy on the business owner side of things. Because up until that point, I had worked in other people's practices. And so I didn't have as much on my plate. And I've always been really big on making sure I take care of my mental health and make sure I refill myself. The one exception to my hard, fast rule of no business outside of business hours is when my pregnant people need me. And so if someone's going into labor or if they're having an issue regarding their baby, then I will take those calls outside of my office hours, because I attend births and things like that. And babies don't come when you tell them to. They come when they feel like it.
Yeah.
So, yeah.
So you had mentioned COVID earlier, so I feel like that's a great segue into today. So how has COVID really affected your business in the past 8 months?
Okay. In the beginning, I think it was similar to a lot of the other businesses, especially small business. It was a very scary time. No one was leaving their homes. Everyone was afraid. We didn't know what was going on. There was just this new virus that we really had no information about. And so obviously the response was to treat it like it was the worst thing in the world until we knew more, right? And to pull back as we figured out what was safe to do. And so I understood why people were cautious of leaving their houses and wanting to come in and trying to be respectful of that. But it is a very scary time when that's your main source of income. But as things started to open back up, I just kept the mindset of healthcare is important, wellness is important, especially now those things are important, and giving your body all the tools that you possibly can so that if, God forbid, you do get COVID, that you provide yourself the best opportunity to beat it and to have as minimal of issues as possible, right? So I just kept telling that message, and I meant it sincerely and from the heart, and things started to pick back up. And so our office is thriving right now. We're doing really well. We have a lot of families who are coming in who are having that same mentality of like, you know what, now is the time to put my family's health and wellness like at the forefront. We wish we could have been doing this forever, but now we realize that this is truly important and we need to prioritize it. And so we're seeing almost more people than we were prior to COVID-19, helping support those families, everyone from the infants to the grandparents.
That's awesome.
And
go ahead.
no, I was going to say, and wearing masks.
Right.
So even though we come into close contact
yes.
In the office, there are precautions that we take.
Right. I've
That we
definitely
did not
noticed
have to do.
a lot of precautions with the way that you space people out and
Mm-hmm.
requiring the masks
So
and not
yeah, our
using reusable
procedures have definitely changed, and that has been the most complicated part. But we've gotten used to it now because this has been going on for long enough that it's become our new normal. And so we're used to having to space our patients out a little farther, and we're used to trying to decreased contact and making sure that we're sanitizing and cleaning and staying on top of things a little more so than we normally would be as well.
So you had touched on beforehand, you had touched on how chiropractic care really helps your mental health. So I think I wanted to bring that up too, because while health and wellness for your body is important, I feel like now, especially with COVID going on, there's a lot of stress factors. There's a lot of, I just listened to a podcast today and somebody had said, I struggled with addiction for years, and now all of these feelings, the same feelings that I felt through addiction, are coming back. And I think that being able to provide a service that really benefits those feelings is so important. Have you noticed anybody coming in and maybe they're a little bit more stressed out than normal, and just kind of like, how do you handle, what does that look like for you? Does it look any different?
Absolutely. So within chiropractic, and I know there's probably going to be some people who see this who probably have no experience with a chiropractor. And a lot of people think chiropractic, they think headaches, neck pain, back pain, and that's not incorrect. We do great with those things, but what we're really working with is the nervous system. So the brain, spinal cord, and the nerves that come off of it, and that's what controls and coordinates everything in your body. And it's what's responsible for your body's stress response. And in my practice, all my patients know that there are 3 types of stress. We have physical stress, so bumps and bruises, car accidents, all that stuff. Posture. We have chemical stress, so that's anything that's outside in, whether that be tree pollen, allergies, food allergies, medications, things that affect our bodies outside in, viruses, or your emotional stress. And we all, even if it's only on a surface level, we all know that our physical well-being is so closely tied to our emotional well-being, right? You can literally have physical manifestations of pain from your mental health. So what we do in our office is we have a ton of tests that we do, and we can find out where on that spectrum people are and how their body is handling and actually integrating that stress. And what we know is that we can find the areas where they are having issues, remove those, and then the body just integrates stress better. So it doesn't make it to where you don't experience stress. It doesn't make it to where that stress is gone, but it makes it to where your body can handle it a little better, and does a little bit of brain balancing, because we know all of that is just a hodgepodge of chemicals that make us feel overwhelmed. And in this heightened state of stress, I honestly think everyone should be seeing a chiropractor to help with their stress right now, because we are all at 10. And even prior to COVID, I was telling people, chiropractic truly does help your body integrate stress. Mm-hmm. If you are stressed out with work, with home life, with your new baby, finances, all that stuff, chiropractic absolutely can help. And now we have this extra stressor that is every single where that we look. You leave your house, you have to worry about it. You're trying to plan, you have to worry about it. Travel, you have to think about it. Your kids going to school, you have to think about it. And it is this burden that is literally on our backs 24/7, and everyone is feeling it. So I have seen some patterns within patients, like people who were doing really, really well, starting to plateau and take a little dip. And so we've had to bump up some people, we've had to bump up their frequency of care. Like they were coming in maybe once a week, and we've had to see them a little more now because of all of that extra stress. But they know that they need it, and they can see the difference. So that's really been the biggest change from COVID, is some people have had to increase their frequency of visits to compensate for all of this extra stress that we have on ourselves. But they're so in tune with their bodies that they know that they needed that, and they see the benefit. And it's been really good being able to provide that for people during this time when we really need it the most.
Yeah. So, from what I understand, a lot of chiropractors in general, just offices, do not really take most health insurance. And so with COVID being such a time, and even before COVID, with COVID being such a time of people losing their jobs and not being able to afford care, what would be some preventative maintenance that maybe that they could do at home, while they're getting back up on their feet, but to kind of like make it until they can see a chiropractor? Does that make sense?
Absolutely. Yes. So unfortunately, there is nothing that can replace the chiropractic adjustment. However, there are tons of things that you can do to help support your body, like you just said. Yeah. So, one of the biggest things, especially right now, if your main concern is COVID, you just want to make sure that you're providing your body with all of the basic necessities that you need. Make sure that you're eating a well-balanced meal. Make sure that you're taking your supplements. And when I say taking your supplements, I know that can mean a million things to a lot of different people. And so what are the basics? You want a good multivitamin so that you make sure you're getting your core vitamins and minerals. You want to make sure that you're taking zinc because zinc has been shown to boost the immune system. However, zinc is a mineral, and all minerals, we want to make sure that we aren't taking too much of because you can take too much. So before you start taking zinc, you want to make sure that you at least find out your levels. So talk to your healthcare provider or talk to someone who's knowledgeable about that before you just start taking a random dose of zinc. Vitamin D is huge. And a lot of people don't realize you actually produce vitamin D naturally if you're exposed to the sun. So also getting outdoors, that's going to play two parts. So we know that activity helps with your mental health and your stress levels in general. One of the first things you'll do if you go to a really good therapist is they're going to tell you, be active. The one thing that is terrible for your mental health is being sedentary. So being outdoors is going to help on that front. And then getting all that sunlight is also going to help your body produce even more vitamin D. So you get two for there. And then also I strongly recommend meditation. And from my experience in practice, when I recommend meditation to people, they tend to think like, wait, you want me to like sit around and do some ohms and like what? That's kind of weird. But honestly, it doesn't even have to be that big. It can just be as much as setting aside like 5 minutes and practicing a little bit of mindfulness. And you don't have to shut your brain off. A lot of people think meditation is about like silence, and it's not. It's about when you get pulled away, coming back and trying to focus. And it's really just, it's an active practice of trying to focus and be present. And there is no failing. You can't fail at meditation. If you start to think about work, you didn't fail. It's just a practice of, okay, let's try to stop thinking about work. Let's bring it back and pay attention to what's happening in front of me right now. So those things, so your supplements, getting out and being active, and then a little bit of meditation will help you go a long way until you can get back into a chiropractor's office.
Awesome. Good advice. So I have a backstory that has nothing to do with anything except for the ohming. So yesterday, my son Kai was telling me a story about how one of his friends was yelling at him at school yesterday, and he said every time he would yell at him, he would go, I'm like, where did you learn that? What? I mean, did it help? Did he stop? Great. If that's
you gotta bring him down, bring down that frequency. It's too much, just bring it down a little.
I thought I was like, what? So now you're meditating when people yell at you? If it works.
He innately knows.
Yeah.
And I think a lot of times, and not to get too far off topic, we do innately know what's right and we know what works, but we have this educated brain that has just had so much stuff pounded into us that by the time we reach adulthood, we ignore and we suppress a lot of those things that we innately know work.
Yeah. And
so his little brain, he's like, oh yeah, there's something telling me that like, dude, too much, just like bring it down.
Yeah. I feel like you heard it from a show, but as long as it works,
genius.
Keep it going. Keep it going. Yeah. So back to you. What are some of your long-term personal and professional goals? So let's 5-10 years.
Okay.
Start with personal.
Let's start personal goals. Yeah. So personal goals, the next 5-10 years, I'll probably be married. I will probably,
is that a goal or is that just an expectation?
Huh?
Is that a goal or is that an expectation? I mean, I'll probably be married.
I'll probably be married by then.
Jeremiah,
if all go to plan. The goal would be to also have an associate doctor. Oh, I'm talking about personal life personal
Yeah,
life.
it's personal. You got to split it up. It's difficult when you own a business to.
It is. It's so, because they do
It
overlap, and
overlaps
it's
so
so
much.
hard.
Yeah.
So, personal life. Plan on being married. Probably have a kid by then, maybe. Whether they were birthed by me or brought into our family, one of the two.
Yeah.
I would, oh man, it's so hard. Personal goals are so, this is exactly what you're talking about, because we focus so much on our business
Yes.
and we neglect ourselves so much that like, it's so difficult for me to tell you what I want to do.
That literally the last person I interviewed, this was the hardest question that I asked as well, which is just like blows my mind.
Yeah, it's so difficult. But I would actually, one goal that I do have is to have enough in savings to where we can start to take yearly international trips. Because I really want to get more exposure. I'm an Army brat. And so I grew up all over the place. I was born in Germany, but don't remember it. And even though we traveled a lot, I didn't really get to travel outside of the United States. And I think that it is so important for us on many levels to experience cultures outside of our own. And so I really want to be able to do that so that I can have a little more awareness about what's going on outside of the pardon my French, shit show that is America right now.
Yeah. Getting your head out of your own bubble is very important.
And to see, like, even though we're dealing with all of this, there's so much going on in so many other places, and there is still great things happening, and there is peace and beautiful things going on all over the place. So I want to be able to take trips outside of the United States at least once a year.
Well, and just like expanding your cultural experience, really, like, I feel like it humbles you to, like, it keeps you from being so judgy, right? Like when you understand and you can empathize with other cultures, like there's less of a chance for you to like pose a judgment on their culture just because you're ignorant of it. So I'm right there with you on just immersing yourself in other people's cultures, because I don't think that a lot of Americans especially I don't think they do it enough, you know, and I think that that's kind of the root of a lot of the issues that we're seeing right now, is just being in our own bubble and not wanting to leave it. And now we have all of these issues because it's easier to point a finger than it is to empathize.
Let's see. And then business-wise, business goals, I would like to hire on an associate doctor, so to have another doctor in the office. We'd like to expand the practice a bit, and hopefully, especially by 10 years, I would like to have outgrown this space and to need like a full center with multiple doctors to be able to care for people, and possibly have either everything under one roof, so you can come in and see your chiropractor, and then your doula will still be there, and then, you know, you've got cloth diaper service across the street, you know, having a whole facility where people can come and have everyone that they need within a close vicinity of each other, making it convenient for parents, making it to where taking care of yourself is something that alleviates stress and not makes you more stressed.
Right. Yeah, for sure. Yeah.
So we really want to reach out to Tulsans. We've been doing a really good job lately. I've been so happy just hearing the word of people who just know that this is an option. And, you know, even location wise, we may not be the best fit for someone, but just getting that word out there. I can't tell you how many times I have people reach out to me. Hey, I can't really get to your office. I live over here. I don't have transportation, but what you're talking about sounds really good. Do you know anyone around me? And, you know, it's not even about just my business and getting people here. It's about the overall well-being of our community. Right. And if I can help guide people to folks who will facilitate their health journey and improve their quality of life, then that's all that matters.
Absolutely. Yeah, that's we're right on par there with the whole reason permanent diaper relief is a thing, because it's not just about us, it's about everyone, because when
Yep.
when the community thrives, we thrive, right? So
Yep.
yeah,
It takes
absolutely.
a village, and I think that we truly forget that, especially in the United States. We are one of the
Mm-hmm.
few countries where we put our walls up, you pay attention, you worry about you and yours, you worry about your family,
Mm-hmm.
and we take our elders and we put them in nursing homes. They don't come home with us,
Right.
and I think we all could use little lesson in being a little more selfless.
Yeah, for sure.
So,
Yeah, absolutely. Well, thank you so much for taking the time to let me pick your brain about you and your business and all the things. I really appreciate it.
thanks for having me, Maddie.
Yeah.